Well, welcome to the Mackinac Policy Conference. This is Rich Helppie of the Common Bridge on behalf of the Michigan Health and Hospital Association. And we're talking today with Matt Elliott. Matt is the founder of a company called Blue Lake Ideas. He's also the chair emeritus, the board of directors of the Detroit Regional Chamber. Matt, welcome.
Thank you.
Good to meet you.
Great to be here.
Tell me, what brings you to the policy conference today? What gets you excited, and what are you interested in?
Well, this is 15 years of going to the policy conference for me, and I chaired the conference in 2023, which was an unbelievable experience. But the reason why I keep coming back is because of the conversations that we have. These not only deep conversations, but also ones that you can have in an informal setting, and you can make a lot of contacts very quickly. So I'm here for the same reasons that everybody else is, to learn and also to connect.
Over the years, have you seen any progress made in a tangible way, an idea spark that led to an investment, a law, a regulation, anything that stands out during this time?
You know, we've been able to move some things forward, right? So we're able to get roads done, for example, and some of the other changes, for example, that happened in the Snyder administration around competitiveness. I'm also on the board of Business Leaders for Michigan, and we made a lot of progress there. But I think the bigger point is that over the last 2 decades, regardless of political party, we as a state have not done well. And that is really the theme of today's conference, or this week's conference, which is our house is on fire. You know, our educational attainment, our economic attainment has dropped to really bottom decile levels in the United States. And that's not where Michigan wants to be. I think, as Bob said yesterday, this is a state worth fighting for. So we need to come out of this conference and others with better, stronger, more aligned policy and people who are ready to put it into practice.
Well, that's going to be a big job, but I understand that you've doing some research and you've published a book and you've got a theory about this. So tell us about the power of and.
Yeah, when I chaired the conference in 2023, it sparked a lot of energy around this idea of the power of and, meaning that if we're going to be successful, we have to do things like, you know, if you're a company, you got to execute today and invest in the future. If you want to be a leader, you got to take care of your people and you've got to deliver the numbers. That means you can't collapse your decision-making into a simple either or choice. It's got to be both and that's hard work. And so what I've done is spent time figuring out how can we more routinely harness the power of and in a world where we're almost always overloaded. And in fact, that's the title of the book, is that the pace of change in the world comes at us so fast in the always-on AI era that what we need to do is preserve that capacity so we can do the hard work of, in what Bob's Reine's case would be, finding common ground, or in my case would be executing and harnessing the power of and.
Where can people buy your book?
Well, they'll be able to buy it this summer. It'll be out on Amazon. I'm still putting the finishing touches on it. But it's been a lot of research, a lot of work. And also, I work with real clients on this. This is something that's not theoretical. We do workshops and we do consulting. And our clients see a lot of value in the fact that, I realize I can't do everything. I can do anything, but I can't do it all. So I have to figure out what my priorities are and then go execute on that. And I think, you know, as we talk about the healthcare space, it's so complex that it's ripe, in my view, for the power of and.
Indeed. So some of the motivation came from your business career. What's the thumbnail of the business career?
Well, I've got a 35-year career in banking. So I retired about a year and a half ago as the president of Bank of America Michigan, and I also spent 35 years in corporate and commercial banking. And one of the things that I observed in my clients and also in of the leaders that I admired were the ones that routinely found the and. These were the clients, for example, that didn't need every last deal point because everybody needed to be together to do a good deal. I called it, you want to be happy or do you need to be right? And so being happy, my happy clients were the ones that were the most successful. The leaders that I saw were the ones who always were able to find that and. We're going to take care of our people and we're going to consistently deliver results. They're rare and they're hard, but those are the real lasting victories. And I think so often we get hung up in victory in terms of defining it by defeating somebody else. I win, you lose. By definition, that's a zero sum. You need positive sum games. And what that means is that winning now has to be a question of delivering, like delivering for the people that we serve, delivering on the promises that we make to ourselves, delivering on the presence that we owe the people we love. If we do that, then we can really be successful long term.
That's a really interesting perspective, coming from the banking world where the object of the game is destroying the other guy and taking all of their business. But we're talking healthcare now, and the banking world, you know who your customer is. In
Yep.
fact, there's legislation, know your client, right? Because we're trying to prevent fraud and terrorism and the like. So when you look at healthcare, were you able to find the client? Who's the customer?
It is a really, really hard thing to answer. In fact, I've had a couple of experiences with my parents as they were going through their end of life, where I asked the medical staff that same question. Who's the customer here? In my view, it was my mom or my dad, right? And I think everybody feels that way, that the patient should be at the center of everything that the healthcare system does. But the reality of it is there are lots of cross currents. And, everybody wants to find a villain in that story, and you can if you want, but the facts is that everybody is responding to the incentives that are sitting in front of them. And part of finding the end in healthcare is getting aligned around that shared version of success. How do we all win in that? Because there are patients, there are hospitals, there are insurers, there are all kinds of providers that wrap around that to make a successful patient outcome.
So what would maybe be a reform that would spark us getting to that point of having a common ground, a common objective?
I think the first thing is to get some clarity. In the 3-step process that we teach, the first step is pause and reflect and try to get clarity on who and what matters most. I think that's where this conversation needs to start, because in my view, I haven't seen anybody been able to articulate even that, So you can't get to solutions until you know what you're solving for. And I still think we're trying to set up the equation, to be honest with you.
Well, you were an employer of many people, and you bought healthcare for them.
Yeah.
And I'm going to venture that you didn't make everybody happy.
Yeah. You can't do that when you're running a business of 212,000 people.
Yeah. So, but the benefits that you provided were part of their compensation package, yet they weren't taxed on their W-2.
Yeah.
And that really separates them from the process.
That's part of it. And that is definitely part of it. And I think you're raising a great point, is that healthcare is probably one of the most expensive things that we buy, that we consume. But as consumers, as patients, we don't really see the price. And not only that, there is no price sheet. Pricing is opaque. And so part of having an effective marketplace is to be able to have a strong pricing mechanism that allows for economic actors to be able to act accordingly. This is one of those strange cases where even if you ask hospitals, for example, about how they can optimize their pricing, they're in some cases constrained by law and their ability to go optimize for price. And so these are some of the incentives that need to get worked out here. But at the fundamental level, you're right. As patients, we don't see the cost of our own healthcare, except when it comes out of our paychecks every month.
Well, look, a hospital can't run a special on open hearts this week because we've got capacity the way other businesses can do that.
Yep.
You can be available in the community when that need is. But look, your business career spanned that time when it was common for people to ask for a company car as part of their compensation package.
Yeah.
Why don't we see company cars offered anymore?
Well, company cars are, generally speaking, not used as often as people were, and because they changed the tax law, right? So all of a sudden, that's a taxable benefit. And I get a sense for where you're going with making the support for healthcare taxable. But if you can, in some way, shape, or form, create a pricing signal, I think that's a positive step. I also feel like there's so much complexity in the system that there needs to be more stronger pricing signals all the way through it that hopefully collapse some of that capacity or that complication.
I like the way you're thinking. Catch it at the top end, on that tax favored treatment. Any closing comment for the good people at the Michigan Health and Hospital Association and the Common Bridge?
Well, I think number one is just how critical healthcare is, not only as human beings, but also from an economic point of view. Hospitals are almost always the largest employer in every town. We're right now under threat for having access across our state, because it's very difficult to maintain, for example, a rural hospital. So hospitals are not only providers of care, they're economic engines, and we've got to make sure that they stay healthy.
We've been talking today with Matt Elliott, the founder of Blue Lake Ideas. Look him up and watch out for his book coming out this summer, The Power of And. And this is your host, Rich Helppie, for the Michigan Health and Hospital Association and the Common Bridge, signing off.